Hello, my name is Aoife Rovero, and I'm the founder and the executive director of the National Coalition Against Prescription Drug Abuse, whose mission it is to prevent substance use disorder and overdose deaths through communication with our community members. Everybody has probably heard something about the opioid epidemic. This is a national problem where we have a lot of people becoming addicted, forming substance use disorder, not always because of recreational use, which is sometimes the case, but primarily through the prescribing of medications to treat a pain problem, whether it's a car accident or maybe post-surgical. And so our organization has been paying a lot of attention to this epidemic, and we're doing everything we can to get the word out about the dangers of these prescription painkillers and the potential for these things to happen. Today, we are going to be discussing what can be done to treat pain without medications. And we're very happy to welcome Dr. Dennis Barker, who is a doctor of chiropractic, to join us today. And he will be talking about how to manage pain without opioids or painkillers, as they're commonly known. So Dr. Barker, thank you so much for being with us today. And
I appreciate the opportunity.
Welcome to our learning opportunity here.
So what I'd like to do, since we're going to be talking about pain, I'd like to differentiate the type of pain we'll be talking about. Now, cancer pain is going to be treated differently than pain from a car accident. Or pain from rheumatoid arthritis would be treated differently from the pain that you would have from working in your yard too hard or lifting something heavy. So we're going to talk about the most common types of pain. In 2013, the Mayo Clinic did a study where they looked at the top 10 reasons that people see a primary care provider. And pain was 3 of those reasons. Joint, osteoarthritis pain, back pain, and headaches and neck pain. So that's where we're going to focus today, just for time's sake.
Okay, yeah, that's a good start. So first question I've got for you, Dr. Barker, is why should someone consider a non-drug treatment option for pain? And, you know, most people, I think that prescription painkillers are the way to go, that they're somehow going to be a quick fix and get a pill, they go home, take it, and they're going to be, you know, not feeling the pain that they had going in. So why would we want to try something else?
That's a great question. And the way that you put it is absolutely correct, because when they go to their primary care provider, they're generally going to be given a medication. That's what their insurance is going to cover. And so that's where they feel some relief right afterwards. So they must think, well, I'm on the right track. Let's just look at addiction and side effects. The CDC on 2018 pointed out there were 67,000 people died from overdose, and 70% of those were a prescription or illicit opioid. In 2014, the Harvard Center for Ethics newsletter stated that approximately 128,000 people per year die from drugs prescribed to them. Let me say that again. 128,000 people die every year from drugs prescribed to them, making it the 4th leading cause of death. The National Institute of Health, excuse me, pointed out that people given opioids, 21 to 29% of those actually misuse them, and 8 to 12% will develop an opioid use disorder. Many also think that drugs are the most efficient or effective treatment. Mm-hmm. And actually, the research shows that that's not true. In 2015, the British Medical Journal published a study looking at the use of opioids for low back injuries or low back work injuries, and found that they did not get people back to work sooner. They did not improve their function. And on average, they had about a 30% decrease in pain. And there are other studies showing even a lower margin of decrease of pain. The irony of this is that if you go to a primary care physician, 90% of the time you're going to be given a medication. Mm-hmm. While we're seeing about 54% decrease in opioids, you're still given another medication. The American Academy of Family Physicians, the American College of Physicians, these are medical treatment associations that create guidelines on how these conditions should be treated. And their guidelines, printed in 2017, state that the initial treatment for low back pain should be non-pharmacological, meaning if you go to your primary care doctor with lower back pain, you should not be given meds. You should be recommended a non-drug treatment. And the problem that some feel, the reason that you do not get these is, one, insurance isn't covering them, and two, the physicians aren't trained in the treatments that are recommended. And the treatment guidelines for neck pain are very similar to lower back pain. So we should not be given medication on that initial treatment for acute pain, meaning pain less than 2 months, or even chronic pain, pain that you've had for over 3 months, should not be started. The initial treatment should not be a medication.
Okay, so it sounds like there's some really good reasons. Number one, the guidelines are out there, and that's obviously developed. The guidelines are developed because of research they've done, and they come to recognize what works and what doesn't. But then secondarily, we know we've got a raging opioid epidemic, and so clearly the way things are being managed right now aren't working really well. And so I would really like you to tell us more about the treatment options that are out there that should be really considered by those that have a pain issue, even when they're talking to their doctor, and don't blindly take that drug. Let's have a conversation and explore some of these other modalities that might work better or just as well, and you don't have to worry about downstream impacts.
And what you said is very important. Have a conversation with your doctor. If you're given medication, a great question would be, is there another way that I could treat this pain?
Yeah. And
go from there. Your doctor's a person too, and they want to help. And often, because of insurance limitations, they feel that that's the only way that they can help you. But open up that conversation. Now, if we look at the treatment guidelines, when I'm going to be telling you about these treatments, these are out of the guidelines. And as you stated, the guidelines are developed by using the research that's out there. And these treatments that are recommended because they have the most evidence behind them. It's evidence-based treatment. There's more evidence to support doing a non-drug treatment for this pain than for using drugs. That's the main point I want to get across here. So let's look at, for acute pain, the treatments recommended are massage, superficial heat, acupuncture, and manipulation. So let's look at some of these, and I'll go a little bit deeper into them. With massage, the interesting thing about massage is that when you touch someone, you actually decrease cortisol. Cortisol is our stress hormone. And when you decrease cortisol, your body goes into more of a healing state. When you actually touch that person in using the techniques that massage therapists are trained in, you stimulate sensors in the muscles that get the muscles to relax. It does that by sending impulses up your spine to your brain, the front part of your brain called the prefrontal cortex, which helps to modulate or decrease the amount of pain that you actually perceive. So just that process of being touched and then in the correct manner makes a huge difference in pain. When it comes to heat, there's actually good evidence with heat. There's evidence to support ice too, but let's just talk about heat quickly here since it's in the guidelines. What I like to tell patients with heat is moist heat is far better than a dry heating pad. When you have moist heat, it has to do with thermodynamics, which I could bore you with, but basically, if you have steam coming off, you have more energy and heat energy coming off and that will penetrate deeper into your tissue. An electric heating pad feels nice, but it really doesn't get down into the muscle. Moist heat will. Now, when we look at the chronic got the recommendations for chronic pain. They also recommend acupuncture, manipulation. But if we break it into, and they have a longer list of treatments, if we break it into groups, there's exercise, there's manipulation, acupuncture, and low-level laser therapy, which I'll talk about, and then basically biofeedback and behavioral therapy, which is working with your brain's perception of the pain and working to control body processes. Quickly, if I was going to describe it, when you're in pain, your heart rate starts increasing. You take more shallow breaths.
Mm-hmm.
And then that affects your prefrontal cortex, how you are perceiving the pain. You'll start to notice more pain. Now, if you can catch that and start breathing a little bit slower and deeper, start to lower your heart rate, maybe work to relax some of the muscles, your perception of pain will go down.
Mm.
That's one of the ways that these work. What I often will tell people is you can go onto YouTube and find guided meditations for free. And particularly if you're suffering from chronic pain, that's a great way to get started. When it exercise, we look at that. There's exercise classes, there's rehabilitation, there's Tai Chi, yoga, and something called motor control exercise. Those are all different forms of exercise. Exercise is an incredibly effective way to control pain. Once again, our brain is where we perceive pain. Exercise stimulates that prefrontal cortex and helps us decrease the pain that we're perceiving. If you go down to the segmental level of, say, your lower back, and those muscles are weak because you've been sitting in a chair too many years now, and now you're starting to get pain from that. Yes, it helps by strengthening those muscles, but pain is something that we notice in our brain. And we're noticing more. There's great research coming out in neurophysiology, and we're finding that by stimulating that part of the brain, it makes a huge difference in how we feel. Low-level laser therapy is something that's most commonly you'll see in chiropractors and offices and PTs. And it's using lasers that penetrate deep into the tissue, and they stimulate the cells to work a little faster. It increases the metabolic rate of cells and increases the healing, the speed of the healing of the cells.
Mm.
By increasing metabolic rate too, they also use it for spot reduction in fatty areas, but that's a whole nother topic. Acupuncture has quite a bit of research behind it for many uses, for headaches, for neck pain, for back pain. They use it, sometimes you'll see for anesthesia, for surgeries, for recovery, for different visceral problems, indigestion, and so on and so forth. Let me back up and say that acupuncture is working to improve the health of the person. And the healthier you are, the better you are at healing from whatever ails you. And that's, if I was to break down acupuncture into its smallest component, that's what it does. Chiropractic works similarly, except we're a little bit more segmental in going to where the pain is perceived.
Mm-hmm.
Now, manipulation is mentioned in the treatment guidelines in acute and chronic pain. It's mentioned in the British Medical Journal guidelines. It's got a tremendous amount of research to support it. Manipulation is done by chiropractors the most. Over 90% of the manipulation done is by chiropractors.
Mm-hmm.
But you also have doctors of osteopathy, or DOs, that use manipulation. And you have some physical therapists that are starting to manipulate. The group that has the most training by far, by more than 2 to 1, is chiropractors, because that is the bulk of what we do.
Yeah.
99% of my day, 100% of my patients, I'm using some form of manipulation.
Yeah,
There are
that's
over 200 different techniques.
Mm-hmm.
And so for people that are very, let's say, have osteoporosis or have disc injuries, migraines, we have different techniques for those people. I'm going to adjust a 1-year-old much differently than I'm going to adjust the guy that was a linebacker for the Eagles. And I'm going to adjust him far differently than the 102-year-old woman with osteoporosis.
Mm-hmm.
So that's why we use those different techniques. So that's, in a nutshell, the different types of treatment that are recommended by the guidelines for pain, or musculoskeletal pain.
I'd like to go back to just one of the modalities, and it was just the moist heat one. I think that you shared with me in the past that people can do that right at home. It would be maybe the bean or the rice bags or whatever that many of us have.
Oh, definitely.
So explain that one real quick, just to make sure that
yes,
we get the full advantage of that one. That's so easy to take advantage of.
Almost definitely. When it comes to home care, heat and ice are two things that I think are incredibly effective and really cheap.
Mm-hmm.
When it comes to the moist heat, you can use a hot shower, a hot tub, but there's those hot packs that generally have rice or beans or different things inside of them that you can stick in the microwave, and when they come out, spritz it with water, and that'll help produce steam.
Okay.
Much more effective than an electric heating pad.
Yeah, we can do that before we ever go see any doctor. So
No, and here's the thing: when someone calls me, particularly in an emergency,
mm-hmm.
And I find out that they're having trouble moving and they're really locked up, I will often have them ice or heat for a period of time before they come in, so at least I can even touch them.
Yeah, that helps, I'm sure. The other thing I wanted to talk about is pain management, particularly for young kids. So teenagers who might be out playing sports. We know that almost everybody that plays sports ends up with some kind of injury over time, right? So how, I'm really concerned about that because we know the teen brain isn't fully developed until that 25 years old. And we also know that they're more susceptible to opioid or any other kind of substance use disorder forming. So can you speak to that? What can you share about, again, the importance, I think, of these other modalities that you'd want parents to know?
There were far too many high school athletes that ended up as addicts because of opioids.
Mm-hmm.
If you have a child that's involved with sports, be it they're in elementary school at soccer, or you have a high school football player or a gymnast, you need either a chiropractor that's familiar with sports treating athletes, a acupuncturist, a massage therapist. Often there'll be a team of those, but you need someone like that to evaluate your athlete, because if you take them somewhere else, they're generally going to get medication and told to rest.
Right.
We get people back on the field faster, and the data shows that just because of the way that we work. And so that I can't recommend enough to get one of those people on your team that knows your kid is comfortable with them, and that way when there's a problem, you can get them there right away and get to work on that problem so they're back on the field as soon as possible. Mm-hmm. I've been a team doctor for football teams, and it's so crucial to have someone like that in your healthcare team.
Mm-hmm. Yeah, and physical therapy, I know that is also a really good place to go versus pills too. The other one I wanted to talk about, the category, would be someone who's had a substance use disorder, an opioid use disorder, right? And let's just say they have an accident, maybe a car accident or whatever, or maybe there's a surgical situation they have to go through. Well, I have heard way too many stories about how the surgeon prescribes opioids right after surgery, even sometimes knowing that that person is in recovery with an opioid use disorder. So can you speak to that issue? I have many examples of that out there where they got right back into their addiction because of prescribing for a legitimate health issue.
And not just surgeries. I've seen so many patients over the year that have been involved in a car accident, and they go to the ER and they're given a big bottle of meds,
Right.
actually a couple bottles of meds usually, and and sent out the door. It is so important to treat these patients with a manual therapy. Manual therapies being acupuncture, manipulation. Let me explain again. Our brain is where we perceive pain. And the research coming out now is just so exciting. We've seen that, for example, with manipulation, when we adjust a spine, when we stretch those little muscles in the spine, it sends information directly up to that front part of your brain, that prefrontal cortex, which suppresses the amount of pain that you're perceiving. It also, the other thing the prefrontal cortex does is it suppresses the limbic system, which is responsible for addiction. So someone that has an addict that is experiencing pain, I can't recommend enough that they get a manual therapy, such as chiropractic. The data is showing that it stimulates their brain in just the exact way that they need it. And it's the most effective way, according to the guidelines, to treat their pain. The meds are not. They're not recommended.
To me, great. I also just wanted to go ahead. I'm sorry, you had something else.
I would like to say this, so I don't. I can sometimes get excited about this. Sometimes I can come across as a little hard-nosed. There are times over the years, and I've been in practice for 29 years now. There are times when I have patients that come in that are in so much pain, they can barely move. They can't sleep. Just sitting down on the toilet is excruciating for them. I have those patients call their primary to get some meds so that they can function. I understand there's times when they're necessary.
I do too.
The point I'm trying to make today is that the treatment guidelines state that the initial treatment should not be that. There are times when they are necessary, but when I'm working with those patients, our goal is to get them to a place where they don't need them much faster.
Right.
And myself, I've had 2 disc herniations myself, one treated surgically. So I know there are times when you need that medication.
Well, I know that the CDC guidelines that came out maybe 3 or 4 years ago are that even after surgery, you really shouldn't be prescribed more than a 2 to 3 day, amount of medications of opioids. So I think that's important. I think that's kind of shocking for some people because we're kind of typically prescribed a 30-day supply, and it's like, okay, here you go, and you kind of think if the doctor prescribed it, I must need it for that long, but you don't. And we need to wean ourselves off of those as quickly as possible, I assume, right?
Anything longer than 3 days is considered high risk. A study came out, I believe it was last year, looking at from 2012 to 2016, I believe, looking at that there was a 54% reduction in initial opioid prescriptions, but the high risk prescriptions, which are greater than 3 days or higher dosage, haven't changed. So the 3 day, getting longer than 3 days is actually, high risk. And I remember earlier in 2010, I would see so many patients that come in and they'd have a bottle of 100 Vicodin and Soma. It was crazy.
Well, and the other problem is that really most people don't finish taking them. You maybe get a 30-day supply, but you don't need them all. You realize that. You come off of them, and then those medicines sit in the medicine cabinet, right? And then there's, potentially going to be picked up by the young people in the family or anybody in the family, friends, neighbors, cleaning people, whoever. So that's another issue. So
Yes.
let's move on. You know that one of the problems, maybe the hurdles that can keep somebody from going to get the care that the care options that you've talked about is insurance. Not all of these modalities are covered by insurance. So can you speak to that? How does somebody get the care, avoid these painkillers when they can't afford maybe the other modalities that we've been talking about?
That's a great question because actually very few of them are covered by insurance. And there are papers talking about how the insurance industries propagated the opioid problem through cost containment.
Mm-hmm.
The short answer is some of them are covered, such as manipulation and acupuncture. We're seeing more of it being covered. The coverage is often spotty at best. Acupuncturists, chiropractors, we're accustomed to providing service that isn't covered by insurance. And so we've had to adapt and provide a service that is affordable in ways that people can't afford it. That's basically what it comes down to. So I tell people, if you feel you need this treatment, but it's not covered by your insurance,
Mm-hmm.
call one of these providers and talk to them. Schedule a consultation. And I do these complementary all the time. And talk with them, tell them about your problem, and find out what they think it will cost. Because when I tell people I meet on the street about, I'll suggest they get some chiropractic care, and they'll say, well, it's not covered by my insurance.
Mm-hmm.
Do you think your insurance company determines the treatments provided to you based on what they think is best for you?
Mm-hmm.
Absolutely not. They're a business.
Yeah.
They're a big business about making money. That's not how it's determined. Now, granted, we're seeing some change, but just because your insurance company doesn't cover it doesn't mean the treatment isn't good. I just showed you these treatments are recommended by medical associations, and most of them are not covered.
Yeah, that's really a shame. I mean, I feel like more advocacy work has to be done. And, we've talked
Definitely.
about that line, you and I. So, okay.
I think what's going to happen is they're going to have to realize the savings that they will see by utilizing these treatments, the long-term saving.
Right.
Short-term, they look more expensive. Long-term, they are cheaper. Because they found through the opioid epidemic that by just paying for opioids, it's cheaper in the front, but long-term, you now have disabled addicts on your hands. And for the workers' comp system, that's where they've really found out how bad that can be.
Right. Okay. Well, how would somebody go about finding a chiropractor or acupuncturist or whatever, they might be seeking? What's their best bet to find those?
So my suggestion is if you have insurance and it covers those treatments, start there.
Mm-hmm.
If you do not, ask a friend. If you're in the room with your primary care provider and he's writing that prescription and you say, well, are there any other treatments? Ask them if they have someone they refer to. You can also go to the state associations for these professions. So for example, the California Chiropractic Association has calchiro.org where you can find member doctors. The acupuncturists have the California State Oriental Medical Association, which is csoma.org. That's a great place. Those are two great places to start. I'm happy to take questions. You can email me, and my email address is there. And our website's ticevalleychiropractic.com.
Okay. Well, thank you so much. These are excellent resources. And then I just want to also share with everyone that we can be contacted also if you have an interest in getting involved in the prevention work we do, community education and that sort of thing. We operate throughout the country, but with a high focus on the Contra Costa County, we actually lead the Contra Costa County Meds Coalition. So anybody in the Contra Costa County environment that wants to help with focused attention to our county would be welcome to contact us at any time. So Dr. Barker, I just want to thank you so much for being here today. I think the information you provided is just so valuable, and I really hope will be taken to heart. Maybe open up some minds to other possibilities that can help us all stay clear of these medications that can cause such damage. As you said, sometimes you just can't avoid them. Sometimes the pain is bad enough, so you just really need them for a short time. But then what else can be used as a complementary service, or what can we do to manage it beyond maybe that first 2 or 3 days and get well faster, right? That's the plan.
Well, you bring up a great point in that often, particularly bad cases, it's not just one treatment that you need. You need a combination of treatments. With really bad cases, they need some meds so that they can just sleep and move.
Yeah.
Then they use some chiropractic care to start to really treat that spine and get it moving better. A good chiropractor is going to have you doing exercise. I have every single one of my patients doing some form, start with stretching and then exercise. We're going to talk about their diet, supplementation, all those bottles that you may have seen behind me. Those are all different supplements. We want to improve the overall health of the patient, and it's not just one thing. It's not just they need their back cracked. We need to get them sitting in a better position, get them sleeping in a better position, get them moving better, get them exercising. It's the big picture.
Yeah, I always go back to this, medications can maybe help the pain, get it down to a manageable level, but it's really not fixing anything. It's really kind of just a Band-Aid, right? It's masking the pain at some level, but it's not getting to the root cause of the problem, where I really feel that what you're doing gets to the root cause. And it really is helping to correct bad behavior, bad posture, all those things that can really cause some chronic issues with your body.
Well, if you think about something that we see quite often, which is headaches. Most headaches, or let me say a large percentage of headaches, are what's called cervicogenic, meaning that the pain is actually starting from the neck. Look around when you're out and about at how many people, or even in your house, everyone has their head bent forward, looking at a phone or looking at a tablet. They're walking down the street like that.
Yeah.
And then when we're working, we're looking down at a laptop. Our heads are bent forward so much that we actually straighten the curve in our neck. We increase the pressure on the vertebrae and create neck pain, shoulder pain, and headaches. So there's a lot of steps that we have to take to make some changes.
Yeah.
But when we see that patient, we have to not just treat the problem in the neck, but we have to work on their posture and all the steps that got them to that place. We have to work on how they hold their phone, iPad holders while you're in bed, so that it's up and you can keep your neck in a good position rather than bent forward all the time. Yeah. So there's a lot of steps to get that patient better. The medication is just treating the inflammation that results from the bad posture.
Yeah. We'll have to have you come back to talk about ergonomics and posture. So I think today, though, we have reached the end of our conversation.
Yes.
So we could go on and on forever, I think. Thank you again so much, Dr. Barker. Really appreciate everything you've shared with us today, and look forward to talking to you again.
Thank you.
Take care.